Hi everyone, if you're watching this for the first time, my name's Marianne. I'm the owner and the counsellor at Marianne Hanson Counselling Service. And what I want to talk about in this video is how to get the most out of your therapy. So many people have taken a long time before they actually access therapy. They spend a lot of time thinking about it. That's because there's a lot of fear or nervousness about whether therapy will work, nervousness about whether they'll click with the counsellor. There is lots of issues which prevent people from even making that first phone call or email. But to get the most of your therapy, these are just 5 tips that I think are really helpful. The first one is to think about what you want to talk about before you even get to the session. The amount of counselling sessions I've had where people have had their full assessment, they've come to counselling, and then they get to their session and they say, I'm not sure what I want to talk about. Or the session can feel awkward, not with my private practice clients, but this has happened a lot with if I've had referrals where other people have done the assessments, or if I'm working on the telephone helplines. People want the therapy, so they keep saying, I want therapy. And a lot of times it's because they want the pain to go away, or they feel that therapy is the best option. But they get to therapy and have nothing to say, or they just are struggling to engage in the process. So you need to, before each session, if you know that counsellor is phoning you at a certain time, or you've got your video call at a certain time, or it's face-to-face, you already know in advance that you're going to be having a therapy session. So the key thing is think about it beforehand. Take a few seconds to say, right, what am I going to bring to this session? Or if you don't know, you can get to the session, and then when you're in it, you can think of the reasons you were there in the first place. The second thing to do is to be honest and open in the sessions. There are many people that struggle with whether it's to do with having a shy personality, whether it's to do with just not being able to communicate. Your counsellor can, of course, help you with that. We're not there to push people beyond their comfort zone. We're not there to say to you, you have to talk, or you can't be silent, or make you feel uncomfortable. However, if you just come for counselling because you feel you have to be there, or someone's told you to, and you're not really being honest about what the issues are, this can happen a lot in couples counselling. So you will probably speak to each person first, and they say, this is the reason we want couples counselling. Then you get in the session, and then there's a bit of dishonesty. So people are either downplaying what the issues are, or they are just not being honest. They're not taking responsibility, or they're not saying, look, this really bothered me when this person did this. I think it's a protection thing in couples counselling where they don't want to come across as though they're bad-mouthing their partner. With individuals, I think it's that difficulty of being vulnerable, which I understand that. But in order for counselling to be as productive as possible, you have to be honest and open with your counsellor. Trust that the counsellor will build the rapport with you. The third thing is to use the time and space effectively in the best way. You only get 50 minutes for most counselling sessions. Couples, it's normally an hour. Now, that is just once a week you may be seeing your counsellor, sometimes once a fortnight. So use the sessions. The sessions are there for you. Many people will go, as I've said, I've got my own beliefs that free therapy is sometimes tricky because people will access it purely on the basis that it's free, whether they need it or not, or sometimes they need it, but they don't see the value in therapy. Now, I'm not saying that therapy that's free shouldn't be allowed, because there's a need for it. But I just feel from my experience with private clients who are paying for therapy, they use the therapy sessions because they know that, do you know what, I've paid for this, and if I don't make the best of it, then I'm going to lose out. I've actually lost the money I've paid. Whereas if it's free, you haven't really lost anything if you just come to the sessions, cancel, don't say anything, don't you make the best of them. You don't get anything from it, but you're also not losing financially. So it is about use that time. Say to yourself, this is my time. This is the one opportunity I have, so I'm going to use it. The fourth thing is to build a rapport with your therapist. Your therapist will be building that rapport anyway and establishing trust, because without trust, you're not going to open up. However, you also take some time to get to know your therapist. Build up that rapport, because you know that that's what you need as well. Without rapport or trust, it's really going to be difficult for you to both have an effective therapeutic relationship and for progress to happen. So it's just important that you say to yourself, I'm going to at least allow the trust to build and allow the rapport. And the final thing is you need to do the work outside of the therapy room. Too many people go for therapy and they want something to be fixed. I've heard lots of times where people say, I want to fix this problem. I want the therapy to fix me. You know, therapy is once a week or once a fortnight, as I've said. Outside of that, you've got many days, 6 days in a week, separate to when you have the counselling, and loads of hours where there's no therapy. You, as a person, you shouldn't really be coming to therapy each week in the same place that you were the week before and saying, okay, well, let's do the therapy, then leaving, taking no action, then coming back next week, well, let's do the therapy, and then leaving. In long-term therapy, it's going to take time for you to heal. It's going to take time to really process what's happening. And I think even short-term therapy, at times it can take time. But I think do the work means that when you leave the therapy room, think to yourself, okay, well, what have I learned from this? What have I taken from the therapy? What can I put into action? How can I move forward and progress, even if it's in a tiny way? But I do think that these are the key things that I think will help if you're in therapy and what will work. Think about what you want to talk about before the session. Be open and honest in the counselling. Use the time and space effectively in the best way. Build a rapport with your therapist and do the work outside of the counselling. If you do all of those things, there's a higher likelihood of the therapy working. So I hope you found this video useful. If you have, feel free to share it with others. And if you want to consider subscribing to my channel for similar videos, feel free to. Thank you for watching. Bye.